Are you managing diabetes and wondering which vitamins could actually make a real difference? You're not alone. Today, we're diving into the top 3 essential vitamins that every diabetic should know about. Vitamins that go beyond the basics and actually support your blood sugar, nerve health, and energy levels. Whether you're dealing with fatigue, tingling in your hands and feet, or stubborn sugar spikes, these vitamins could be the missing pieces in your routine. Let's break it down in a way that's clear, science-backed, and practical. Stay with us until the end, because not only are we going to explore these 3 vitamins, but we'll also share some food sources that can help you boost your intake and maximize their benefits. Let's get started. The first vitamin we're going to talk about is methylcobalamin, also known as vitamin B12. Now, you might be thinking, vitamin B12, isn't that just for energy? While it's true that many people associate B12 with boosting energy, for diabetics, it has a much deeper impact. A deficiency in methylcobalamin can show up in some unique and sneaky ways. One of the most telling signs is worsening nerve pain or numbness in the hands and feet. This can be confusing because diabetes itself can cause neuropathy, but when B12 is low, the nerve issues can get noticeably worse, and they won't improve just by managing blood sugar levels. Some people may start to lose their balance, especially in the dark or when their eyes are closed due to nerve damage in the spine. Others might feel foggy-headed, forgetful, or unusually down. These symptoms are often brushed off as stress or aging. A swollen red burning tongue or a strange burning feeling in the mouth can also pop up, which is quite specific and not something you'd typically see with other vitamin deficiencies. One of the main reasons this happens is because of metformin, a common diabetes medication that can interfere with B12 absorption. Even if someone eats well, they might still be running low without realizing it. It's more common than you might think for diabetics to have a methylcobalamin deficiency, especially for those on metformin. Studies show that up to 30% of people who take metformin for more than 4 years develop a vitamin B12 deficiency, even at lower doses. Age also plays a factor. Around 15% to 20% of adults over 60 are B12 deficient, even without diabetes. If you fall into this category, it's worth paying attention to the symptoms. It's more common than you might think for diabetics to have a methylcobalamin deficiency, especially for those on metformin. Studies show that up to 30% of people who take metformin for more than 4 years develop a vitamin B12 deficiency, even at lower doses. Age also plays a factor. Around 15% to 20% of adults over 60 are B12 deficient, even without diabetes. If you fall into this category, it's worth paying attention to the symptoms. So what happens if you're low on B12? Well, methylcobalamin is crucial for DNA synthesis and red blood cell production. A deficiency can slow down cell repair, leading to macrocytic anemia, which causes fatigue and weakness. It also affects neurotransmitter balance in the brain, and long-term B12 deficiency can even shrink brain volume, raising the risk of cognitive decline. The cardiovascular system is also at risk because B12 helps break down homocysteine, an amino acid that, when elevated, can damage blood vessels and increase the risk of heart disease. Even the gut is affected, as B12 deficiency can damage the intestinal lining, reducing nutrient absorption and contributing to worsening health over time. The good news is that overcoming a methylcobalamin deficiency is usually pretty straightforward. Once it's caught, the results can be surprisingly quick. For most people, taking oral B12 supplements, typically 1,000 to 2,000 micrograms daily, can restore healthy levels. If the deficiency is severe or symptoms are intense, B12 injections may be necessary to bypass the gut and go straight into the bloodstream. These are usually given once a week for a month, then monthly as maintenance. The second essential vitamin for diabetics is folic acid, also known as vitamin B9. You might not realize this, but a deficiency in folic acid can quietly mess with your health in ways that aren't immediately obvious. Most people think of folate as something you get from leafy greens like spinach, but folic acid is the synthetic version of folate found in supplements and fortified foods like cereals and bread. While folic acid sounds simple enough, here's the catch. The body has to convert folic acid into its active form, methylfolate, to actually use it. If you're one of the 10% to 15% of people with a genetic variant called the MTHFR gene mutation, your body might struggle to make that conversion, even if you're taking folic acid supplements or eating folate-rich foods. This could leave you with a hidden deficiency that's tough to catch, but that's where the problems begin. If you have diabetes and a folic acid deficiency, you might notice that you're feeling more tired than usual, not just at the end of a long day, but all the time. This can lead to brain fog, which makes it hard to focus, stay mentally sharp, or stay positive. Folic acid is also important for nerve function, so if you already have some nerve damage due to diabetes, a low folic acid level can make that pain, numbness, or tingling worse. It's like putting a magnifying glass over the nerve problems you already have. But here's the kicker. Folic acid deficiency can also mask a B12 deficiency. B12 is essential for nerve health, and if it's not caught early, a B12 deficiency can lead to irreversible nerve damage. One of the reasons diabetics are more likely to be deficient in folic acid is due to metformin. The drug can lower folate levels by 15% to 20%, especially with long-term use. And insulin resistance, which is common in type 2 diabetes, further complicates the situation. When folic acid levels are low, it affects multiple systems in the body. It can interfere with neurotransmitter production, leading to depression and anxiety. It also plays a role in breaking down homocysteine, an amino acid linked to cardiovascular disease. Elevated homocysteine levels are found in many diabetics, raising their risk of heart disease and stroke. So how do you correct a folic acid deficiency? First, eat folate-rich foods like leafy greens, lentils, and citrus fruits. Fortified cereals are also a good option, as they often contain a high amount of folic acid. If food alone isn't enough, folic acid supplements are an easy fix. The typical dose is around 400 to 800 micrograms, but if you have an MTHFR mutation, methylfolate supplements may be a better choice because they don't require conversion. The third vitamin on our list is P5P, the active form of vitamin B6. This form of B6 is especially important for diabetics because it bypasses the liver conversion process and is immediately available for use in metabolic processes. P5P plays a crucial role in regulating blood sugar levels and improving insulin sensitivity. When you eat, glycogen stored in your liver and muscles is broken down into glucose, and P5P helps this process along. It ensures that glucose is used efficiently, preventing blood sugar spikes and dips. P5P also supports insulin secretion and helps insulin receptors function properly. This is essential for diabetics, particularly those with insulin resistance. Studies show that up to 70% of people with diabetes suffer from a vitamin B6 deficiency, which can contribute to difficulty regulating blood sugar. Metformin can also impair the absorption of B6, which affects P5P levels. On top of blood sugar regulation, P5P is essential for nerve health. Peripheral neuropathy, a common complication of diabetes, affects up to 50% of diabetics. P5P helps repair nerves and protect the myelin sheath that insulates nerves. A deficiency in P5P can make nerve damage worse, leading to tingling, numbness, or burning sensations in the hands and feet. Supplementing with P5P has been shown to improve nerve function and reduce these symptoms. Vitamin B6 is also involved in neurotransmitter production, which affects mood regulation. Low levels of P5P can lead to anxiety, depression, and irritability. Studies have shown that correcting a P5P deficiency can improve mental well-being and reduce symptoms of anxiety and depression. P5P is also important for reducing homocysteine levels, which can help lower the risk of heart disease and stroke. Food sources of vitamin B6 include tuna, salmon, potatoes, and bananas. However, if you have a higher need for P5P or absorption issues, supplementation may be necessary. Typical supplementation doses range from 25 to 100 milligrams per day, depending on individual needs. In conclusion, these three vitamins, methylcobalamin, vitamin B12, folic acid, vitamin B9, and P5P, vitamin B6, play critical roles in managing diabetes, supporting blood sugar regulation, and protecting nerve health. If you've been dealing with nerve pain, fatigue, brain fog, or blood sugar spikes, it might be time to take a closer look at your vitamin levels. By boosting these vitamins through diet and supplements, you can support your health and take control of your diabetes management. If you found this video helpful, make sure to hit that like button and share it with friends or family who are managing diabetes. Don't forget to subscribe and turn on the notification bell so you never miss an update. Thanks for watching, and take care of your health with one smart choice at a time.